Comprehensive alternatives to blood transfusions. Your guide to understanding and access within the NHS. Introduction. For individuals seeking alternatives to blood transfusions, whether for religious, ethical, or health-related reasons, understanding the array of options and their availability within the NHS is crucial. This comprehensive guide aims to empower patients with in-depth knowledge about non-blood medical solutions, including a special focus on pregnant women. Minor fractions, detailed insight. Minor fractions like clotting factors and immunoglobulins are derived from human blood, but used in highly processed forms for specific medical conditions. The NHS provides these fractions, and it's essential for patients to be aware that these are blood-derived products, although they are not whole blood or blood cells. Synthetic colloids, a blood-free option. Synthetic colloids such as gelafusine are used within the NHS as blood volume expanders. These are not made from blood but are designed to mimic the volume expanding effect of plasma. They are suitable for patients who require volume expansion without the use of actual blood products. Ringer's lactate, a closer look. Ringer's lactate solution, also known as lactated Ringer's or sodium lactate solution, is a type of crystalloid fluid that is commonly used for fluid resuscitation. It contains a mixture of sodium chloride, sodium lactate, potassium chloride, and calcium chloride in water. It's isotonic, meaning it has a similar concentration of salts and sugars as the blood, making it an effective fluid replacement that can help maintain a stable blood pressure and volume during surgery, or in the case of dehydration or electrolyte imbalances. Ringer's lactate is a staple in medical care provided by the NHS and does not contain any blood or blood components, aligning with the needs of patients who decline blood transfusions. Autologous techniques and cell salvage within the NHS. The NHS supports and often provides autologous blood donation and cell salvage techniques, where the patient's own blood is collected and reinfused. The availability of these techniques can vary by hospital and should be discussed with healthcare providers well in advance of any procedure. Special considerations for pregnant women. Pregnant women are routinely consulted about their willingness to accept blood transfusions. It's critical that these discussions are conducted respectfully and informatively. If a woman declines a transfusion, she should be provided with information about alternatives, including the use of cell salvage, which the NHS may offer during cesarean sections and other obstetric procedures. It's recommended that pregnant women discuss the availability of such equipment in advance and understand their rights to informed consent and respectful medical care. Understanding the risk of PPH. The risk of a postpartum hemorrhage, PPH, a significant concern during childbirth, is often a subject of discussion between healthcare providers and expectant mothers. It's vital to approach this topic with sensitivity and not to overstate the likelihood of its occurrence. A PPH is not inevitable, even for those who experienced one in a previous birth. Factors increasing the risk of PPH. During antenatal appointments, the conversation about what increases the chances of PPH should be more prominent. Adequate protein intake is crucial for your body's preparedness for childbirth. Your birthing environment also plays a significant role. Elements that induce adrenaline, such as bright lights, noise, or the presence of strangers, may heighten the risk of bleeding. A full bladder or an extremely long or rapid labor can contribute to a spongy uterus, making it less effective at contracting and leading to increased bleeding. Understanding the specific causes of any previous PPH is essential, as it does not necessarily set a precedent for future deliveries. Creating a supportive environment. To mitigate these risks, pregnant women may seek to create a calm, supportive birthing environment. This can involve dimming lights, limiting the number of people present, and ensuring a quiet setting. A holistic birth practitioner can also provide support for an empowered and natural birth experience. Natural preventative measures. There are natural measures that may help prevent PPH. Herbs like shepherd's purse tincture and cinnamon bark, after placenta, have been traditionally used to optimize blood flow and strengthen uterine contractions. Additionally, certain homemade drinks and nutrition plans can be tailored to support blood health. For those interested in such holistic approaches, reaching out to a knowledgeable practitioner for more personalized information is recommended. Navigating conversations with healthcare providers. Patients are encouraged to engage in open dialogues with their NHS healthcare providers to discuss the risks and benefits of all options, including minor fractions and synthetic alternatives. The NHS upholds the principle of informed consent, ensuring patients can make decisions without coercion. Conclusion. The NHS provides various transfusion alternatives to cater to the diverse needs of its patients. From synthetic solutions like gelafusine and Ringer's lactate to autologous procedures and cell salvage, patients can explore different avenues. Armed with this information, individuals can confidently navigate their healthcare choices within the NHS, making empowered decisions that best suit their medical and personal preferences.